Ladies and gentlemen, class is in session. What is ADHD? ADHD stands for Attention Deficit Hyperactive Disorder. But despite the name, ADHD isn't just about paying attention. It is a neurodevelopmental condition that affects how people manage their focus, how they organize tasks, how they control their impulses, how they manage time, and even regulate their emotions. So basically, ADHD affects the executive cognitive function of a person. Types of ADHD. The first one is the inattentive, which is basically difficulty sustaining focus, being easily distracted, forgetfulness, losing things, struggling to follow through on task. The second one is the hyperactive impulsive, which is basically restlessness, talking excessively, interrupting, acting without thinking. And the third type is the combined, and it is the most common type, which is basically a feature of both of the other two. So if you think that you might have ADHD and you don't know what to do, these are the steps in finding out if you do have it. The first one would be for you to take the free ADHD screener on www.unmaskedhd.com. The second step would be for you to then book your diagnosis if the screener does suggest that you have ADHD. Before you meet with one of our qualified clinicians, we would have opened up to you a series of questions that you basically fill out in the comfort of your home, and then you go on to the diagnosis session, which is basically a 60-minute session with one of our qualified psychiatrists, and they basically get to know you. How can I manage my ADHD? ADHD can be managed in different ways, depending on the patient in front of us. It could be managed either by treatment, so by medication. It can be managed by coaching, and it can be managed by therapy. Number one, with the treatment, before we initiate any form of treatment in a patient, we normally look at the patient in front of us. So we normally look at their drug history, the medication history, if there's been any sort of substance misuse in the past, their heart conditions or their cardiovascular disease, their family history as well is important. We normally find out what their baseline is, so we're talking their blood pressure, their pulse, their weight, their BMI, to ensure that they can actually start medication. And if there are any other comorbidities, so if there are any other medical condition as well. So these are the different things that we take note of before we start a patient on ADHD medication. In terms of the treatment options that are available in Nigeria, they are a bit more limited compared to what's available in the United Kingdom. In Nigeria, methylphenidate or atomoxetine is available for a patient. Methylphenidate is basically a stimulant medication that basically works in the brain, and it helps your focus chemicals, the dopamine and the norepinephrine. So like I said, it's a stimulant medication. With this medication, we do not normally initiate it on just any patient. Like I said, we would have reviewed a lot of things about you before we initiate it. And when we initiate the medication, we usually start at a very, very low dose, at the lowest dose, and then we titrate the patient slowly, basically, making sure that we are monitoring the side effects, making sure we're monitoring how you are responding to the medication. And that's the reason why we have the titration plan on the website, because we expect that we see you every 3 to 4 weeks to see how you're responding to the medication. That is methylphenidate. Methylphenidate can either come as a modified release or an immediate release medication. But again, the choice of medication is heavily dependent on the patient in front of us and their social history, medical history, family history, and other things such as their baseline as well, and their metabolism as well. Atomoxetine is a non-stimulant medication. Again, atomoxetine, before we initiate atomoxetine, we make sure we consider your medical history, family history, social history, substance misuse, and then we start on a low dose as well, and then we titrate up up until you get to your therapeutic dose. Once the patient gets to the therapeutic dose, they can then, when I mean therapeutic dose, I mean that once they get to a medication dose that works for them, this is now the medication they use daily to manage their ADHD. So that is treatment. In terms of coaching, we normally ask that patient, even in addition to treatment, we ask them that they consider coaching, because what coaching helps is with the psychosocial therapy. And what that basically means is how you handle other things, apart from your medication. So things like body doubling, understanding what is happening in the now, and giving you basically coping mechanism of how to handle and manage your ADHD. Whereas the therapy such as the cognitive behavioral therapy is also available as well. And I normally, suggest in some patients where maybe there's abuse, or patients that want to visit the past and see how, basically clear what the past may have done to their ADHD before moving forward. Whereas coaching is more about the now and the future. I hope that answers all your questions regarding management of ADHD.